Keeping care close to home, a major expansion is underway at the Medical University of South Carolina. A new state-of-the-art comprehensive cancer hospital is coming to Charleston for Lowcountry patients with complex cancer needs. That means shorter drives and faster access to advanced care, cutting those travel times in half for families who once had to make a 4-hour trip to places like Atlanta or North Carolina. And joining us to talk more about that here and about what this means for patient outcomes is Dr. Cole and Dr. Cawley. Thank you both for being here with us.
Thanks for having us.
Thanks for having us.
So the main thing of what this means to us here in our area in the Lowcountry of South Carolina is cutting that travel time in half. Why is that such a positive thing when it comes to families and patients that are experiencing cancer?
Well, just to give some context, if you consider the next 5 years in this region, in the state, cancer diagnoses are going to increase by 30%. There's a massive need as we speak. And so we're committed to providing access to best care for those who live in this region. In fact, we make two commitments. I'm speaking as a surgical oncologist. The dramatic research and impactful outcomes that are happening right now means that cure is becoming increasingly a reality. So we want to commit to, and are committing to, best patient experience, period. You should not have to travel to anywhere else. We're building a state-of-the-art facility, regional hub and spoke, so that people in this region can have access to the best care, period. And also committing to making cure a reality.
Cure a reality, I'm sure that comes with a lot of research. What aspect is this facility going to have when it comes to researching cancer?
Well, one of the things that we found as part of MUSC's growth in the last 7 or 8 years across the state of South Carolina and the borders, right on the borders of South Carolina as well, is the number one thing that every community wants help with is cancer. And they want improvement in some way or another, but the biggest thing they all want is they want access to clinical trials, research, the latest cancer. Because when you have cancer, you want to be close to home. And if you can't get to somewhere to get that cutting edge care, then you want it at home. And one of the things we realized is that we can increasingly do that. So we're trying to bring the cutting edge research, clinical trials, very close to home.
Absolutely. And one of the things that you noted is this is working to get a comprehensive cancer center designation for South Carolina. What is that, and how does that elevate the state as a whole when it comes to health care?
Great question. So MUSC has been a National Cancer Institute designated cancer center for about 15 years. That means we have outstanding research, provide great local care, but comprehensive, which is the top level of designation by the NCI, and there's, I think, 72 across the entire United States, means that we have to be able to prove that we are delivering cutting edge care that's available to the citizens that we serve. And so we've been building towards this for a decade. We've been hiring and bringing in the outstanding research capability. We've got clinicians who are second to none, and now's the time for us to deliver. We will have a outstanding application in 2028 for comprehensive. Comprehensive is just the label that's going to underscore the reality of what we're delivering.
And when it comes to just basic care, I mean, you being a surgical oncologist, you dealing with so many patients in the hospital, there's so much of a burden on families when it comes to this. How does Charleston and the Lowcountry, how do they get to work together to be kind of a place of solace during that hard time? I mean, how does this really relieve the burden on families?
Well, one of the things, almost everybody's been touched by cancer to some degree, and they know what you're talking about. Getting to chemo, getting to radiation therapy, getting to surgery, getting back home, all of these things, they put tremendous burdens on the family. What we're trying to make sure we build is that every citizen in South Carolina has access to the best cancer care, right? The best cancer care is done, you pull all those things together, you have meetings where you discuss the patient, you discuss the effect on the family, what can we do better? It's a process. This is not something that it happens and you get over it, but it's something that you deal with for months, sometimes years, in order to deal with the right kind of cancer in the right way. So what we're trying to build is an ecosystem. In Charleston, there'll be the hub. So if you have a certain kind of cancer, you need to go to Charleston for particular kind of care, great, you can get it there. But what we're going to try to do is deliver most of that closer to home. Work with your local hospital, work with your local oncologist, really anybody. And it doesn't even have to be MUSC doctors. We're happy to work with non-MUSC doctors in order for you to get that care. So it's more of an ecosystem of cancer care throughout the state.
And this really elevates the state. What does this do just for South Carolina?
It will provide, put us basically in best in class. And when we talk about ecosystem, when I said earlier the best patient experience, it's not just a building. It's the providers, it's the talent, it's the environment. So we're going to build an amazing hospital in downtown Charleston. Right next to it's going to be I'll call it a patient hotel or patient transition care, where you can go there and also be in a place that is inviting and supportive of who you are. One of our premises as a health system is that best care is local. This is part of that. Is ideally you get your care locally. If you need to be in Charleston, you should get there seamlessly. And in that transition, you should have the best support and experience possible.
Absolutely. And being there in Charleston, where exactly is it going to be located? How big is it? I mean, really the questions I'm sure a lot of people, because we've seen the renderings, and it's a beautiful hospital right now.
Well, it'll be right down there in the downtown part of Charleston, right next to where the MUSC campus currently is. In fact, it's going to be almost right in the heart of the MUSC campus, and that's done purposefully. It's a hospital. It needs to be near the other hospitals and the other services that are there. So, it's there. It's a 600,000 square building. We hope to have it open in April of 2030. That's what we're gearing toward. It's a very, very fast timeline, but we need to get this done. I can't emphasize enough. Dr. Cole mentioned earlier about the total number of cancer cases that are coming at us. And here in South Carolina, because we have a lot of people moving to the state and we have an older population moving to the state, all those things kind of come together, and the total amount of cancer coming at us in the next 5 to 10 years is pretty significant. So we're trying to get in front of it. We're trying to have that hospital ready. We're trying to have the rest of the ecosystem across the state ready. We're really active here in the Beaufort, Bluffton, Hilton Head area, building those kind of cancer services, recruiting doctors, and working all kinds of other partnerships to get ready for this.
Absolutely. It is, of course, a big expansion that y'all have coming. I know it's a lot in the work, and y'all have been working on it for a very long time. What does this mean to y'all personally, treating cancer patients throughout your time as surgeons and doctors? What really does this mean to y'all personally?
I always, when I'm talking about this, as a surgical oncologist that's been practicing for 32 years, rarely can you talk about cure. I mean, there's many, many things that we do that benefit patients, but in the world of cancer, it's unusual historically to say that. We are now on the threshold of a total transformation of what care can look like for cancer patients. I think the first step will be cancer will be in reality and perceived as a chronic disease. Think of diabetes. 100 years ago, you died from diabetes. But we have the tools now that you can live with it. And eventually we're going to get to where, and in some cases are, as we speak, with some of the research, by the way, that's happening at MUSC, actually getting to cure. To me, that's the most meaningful sort of possibility. To have an impact in patients' lives that's transformational is the thing that gets me up in the morning.
Yeah, absolutely. Of course, that's what everybody wants. I mean, it's an ongoing joke. When the cure for cancer? When is that going to happen? For this many years. Do you see that happening in the next, 30 or so years? Do you see it being manageable like diabetes one day?
Yes.
Really?
As breast cancer is an example. If you looked at where we were 10 years ago, there are thousands of women who are alive and well with breast cancer for decades. So we're already seeing some element of that. You don't label it as such, but 20, 30, 40 years ago, they probably wouldn't be with us. So it's not just a theoretical. It's something that is happening. And in some cases, certain cancers, with the new treatments that are out, CAR T cells is a specific example, and specifically in children's pediatric lymphomas, a 10% survival rate is being transformed into a 60% cure as we speak. So the waves are coming.
Yeah.
We want to be not just riding the wave, we want to be leading in terms of what that looks like for those and for our communities.
Absolutely. Well, thank you both so much for your time. Speaking on anything that I forgot to mention, you would want to add about this expansion.
Well, a couple things are important. We've gotten incredible support from the state legislature. We just launched a $250 million philanthropic campaign as a public-private support system. You know, the city of Charleston has partnered and understands the vision. They've been able to give a zone overlay, which basically allows us to build this facility. So I would just say I'm grateful as people understand, and part of the reason we're here is to help people understand, you know, the vision and what we're trying to do. We've had nothing but support. In the state legislature, we've asked for $350 million in support of this, and in this year's session, you know, they've been supportive with the governor, with the Senate, with the House Ways and Means of $175 million of that. So there's a lot of momentum.
It's great to note. Well, thank you both for being Dr. Cawley, Dr. Cole.
Yes.
It's an honor to have you here. Looking forward to seeing how this moves forward in Charleston and the patient outcomes that we're going to see in the Lowcountry right here in Beaufort County and beyond.
Yeah.
Thank you both so much. Back to you.